what do you see as the next big thing in telemedicine? Or is there a next big thing?
Yeah, I thought you were going to ask me that. Well, you may be surprised by this, and I think John Linketts, the CEO of the ATA, is going to be very upset with this, but I think we're going to get rid of the term telemedicine. Now, what's John going to call his organization? He can't use the American Medical Association. That name's been taken.
Yeah, for 150 years, yeah.
Yeah, I mean, if you were to call me, you're not going to say to me, Jay, listen, I'm going to call you on my wired line, or I'm going to call you on my cell phone, or I'm going to call you on my smartphone. I'm going to call you.
Right.
Fundamentally, the questions that the doctor is going to ask the patient in the history is not going to be any different over the phone or over a telemedicine interaction than it would be in their office.
And it may even be better if the patient is sitting there and typing it out rather than, or if it's already in the system and the doctor just pulls it up.
Exactly. And as a matter of fact, and something that I've said before, but I thoroughly believe in, I really think that in many situations, the exam room is better if it's where the patient lives, not where the doctor works. Yeah. Taking a person's blood pressure in their home is a much better determination. Taking a child's peak expiratory flow rate, if they have asthma, in their home where they're breathing the antigens in that air.
In a real life environment rather than
absolutely.
The sterile environment of a doctor's office.
Right. Now, other things in terms of the future, I think we're going to finally get to that Star Trek science fiction autonomous healthcare delivery system. And I really think, interestingly enough, some of the partners in the medical field are going to be the major technology players, like the IBMs, like the Apples and the Samsungs, like the Googles and the Microsofts, because they're going to be facilitators of some of the technology. And you're going to see other companies trying to mimic Avizia in terms of being a turnkey type of technology company.
And I'm not surprised that you say that, because, going back to the discussion about Mars from 20 years ago, we talked about, well, what to do with somebody who's, millions of miles from Earth, literally millions of miles from Earth, and from doctors, and you have to have things on board. Even now, even for the past 20 years, it's been happening with, defibrillators on airplanes.
Exactly.
That's semi-autonomous. You certainly can talk to the ground. You can ask if there's a doctor on board. That does happen. But, the flight attendants are all trained to, shock someone back to life. You can save people's lives without having to land this second. Still may need an emergency landing, but do it at a more relaxed pace while, they take care of the person's issue, 35,000 feet up in the air.
Exactly. And
it's going to evolve, I'm sure.
100%. And one other area, perhaps, if we have time, where I think we're going to see an explosion of telemedicine in the future, is internationally. I think it's important to recognize that last year, more smartphones were purchased worldwide than cell phones. And I actually think that some of the developing world is going to leapfrog us in the use of this type of technology. Because today, given all of the medical apps for the smartphone for the physician is going to become what I euphemistically call their electronic black bag.
Right.
And for the patient, it's going to be their examination room, because the apps will all be there, and the infrastructure for smartphones, cell phones will be there. So internationally, while the initial move will be for countries abroad to seek out second opinion consultations from the United States, I think eventually they will be self-sufficient with their own system using these types of technologies.